So we have Jiao 1. For Jiao 2, it's about half a sun below where the crease, where the webbing is, and right between the metacarpal phalangeal joints. So you can have the patient make a loose fist to put it right there, and it's right in the middle. And then when you open the hand again, you see it's like about half a sun from the webbing right there. Now with Jiao 3, you stay between the 4th and the 5th metacarpal, and you just go in the depression past the metacarpal phalangeal joint, so right there.
It's like the stomach channel.
Mm-hmm.
And the paratotal joint.
Right there.
Okay.
So shoestream. So that again, that one is like one of the key points for ear. It's like empirical distal point for ear. So if you were asked what's the best distal point for ear issues, it will be Jiao 3. And then Jiao 2 is a point that's in the book. It's not really discussed that much, but Master Dong uses it a lot. It's like, because first of all, it's a point that's good at regulating immune function. So for that, it's combined bilaterally with Shen Guan, which is halfway between spleen 8 and spleen 9. And those 4 points are really good in regulating immunity. So they're not boosting it, they're just regulating it. So it's good for anything from cancer, HIV, autoimmune conditions. It's a really good thing to give the immune system a boost. And this point as well, even though in the books it's not, it's also effective for wind heat or wind cold, like respiratory infections.
I'm talking about number 3.
I'm talking about 2, this one right here. And then one point also where I use 2 a lot, you can go in here and then thread the needle all the way down here, is for any shoulder pain and anything in this area. Because if this is the back and this is the neck and then here are the shoulders, so this kind of corresponds to this area as well. So this is a good point that you can use for shoulder pain as well. And since you thread it down, you actually go through Jiao 3 as well, so you kind of hit 2 points at the same time.
Is this part of, what are these called?
The Bashier.
Yeah, is that one of them?
Yeah, they're similar. They're in that area, yes, by the webbing.
Okay.
Yeah, in Jiao 3, this one, for example, other than an empirical point for ear pain, I also like this one as a distal point for sciatica and hip pain. Because again, it's like the side and it's the shoestream point of the Shaoyang channel. So a lot of time that one together with gallbladder 41 can be really good in relieving pain here in that area in general. So then Jiao 4, you want to kind of wiggle the hand back a little bit because you find that little depression right there at the wrist. So with that one, when the hand is straight like that, a lot of times it's hard to feel, but if you go back a little bit, that opens up that little space. And it's located right there. So now for the rest of it, you have this distance here, which is 12 sun. And it's helpful to kind of put a midpoint on, because that gives you, yeah. So you have the midpoint. And
So from 4 to the elbow?
mm-hmm.
But it's not
Yeah, so I usually go
Not the tip.
right here.
Okay.
You kind of do this. So you have like half, half. So this is where it is. So now with the Jiao channel, the first one you have Jiao 5. So from there you go 2 sun up and you go right between the radius and the ulna. So you divide this into thirds and right there is Jiao 5. So that's right in the middle. And now with Jiao 6 and Jiao 7, they're at the 3 sun mark, but they're next to each other. So how I remember it on the radial side, like by the thumb, that's Jiao 6 because you need the thumb to make a 6. On this side is Jiao 7 because you need a straight line to make a 7. So that's how I remembered 6 and 7 where is what. So hold on, let me see this is. So halfway, so you have 1 here. And the other one is right there. So this one is on the border, like this one is on the, hold on, I gotta see, on the radial border on the ulna, and this one is on the ulna border of the radius. So this is how it goes, and this is halfway between there. And then you have Jiao 7, which is 1 sun more, so it goes like 2, 1, 1. with this one, you go again in the depression between the radius and the ulna. So right there. So you have 3, 4, 5, 6, 7, 8.
For finding these points, does the patient need to be extended?
When you needle it with a patient with those points, few notes. I usually have the arm like that. The key to it is wherever you have the arm, you can't move it after the points are in. Like I always, when I needle, especially these points here, I always go, okay, put your arm where you're comfortable, because once the needles is in, I don't want to move anymore. I had some patients that are very dead to their body, and they would always be like this, and every single time the needle came out with a 45 bend on the bottom.
Nice.
So that's really something like whenever I have them put the arm straight, so I usually have them either like that or like that. Try it again. Stupid air conditioning.
Look at that.
Okay. And so then 9 is actually, now you go from here and it's 5 down. So you find the midpoint, 2, 2, 2. So you find the midpoint again. And then you just, this is 6 sun, and then you just go 1 sun up. So you can do this distance. And you're still between the 2 bones, so it will be right there. And then if you could stand up now and go like this, because now comes
Surely.
10. Other way. Thank you. Okay. So see, you're going right here. And then for 10, you have the elbow tip right here, and then the depression right here. This is where 10 is. Then you have Jiao 11, where you go 1 sun up, and you stay on that line. So that's 11. Actually, can you take your shirt off, please? Because 15, we're not going to be able to get to otherwise. Okay, so now for the rest of the points, you want to locate Jiao 14 first. So for that, I usually relax,
Okay.
hold the arm up, and then look for the attachment right here. So you have the front one here is Li 15. If you go to the one behind, that's Jiao 14. And again, how I remembered it is like that, because I always mixed it up, like, was it Jiao 14 or Jiao 15 and all that? It's always 10 up from the crease. So Li 5 is the point on the wrist, plus 10 is Li 15, and Jiao 4 is the one on the wrist, plus 10 makes Jiao 14. So that's how I remembered where what was. So this is the first one. So now from there, you have that's Jiao 14.
Thanks.
Jiao 13 is from 14, on the line from 14 to 11 at the border of the deltoid. So you basically go from here towards there. This is where the depression is. This is where 13 is. And the reason why I'm backtracking is because 12 is halfway between these. So you just go halfway, and that will get you, oops, right there. So you basically go in the line up. Does anybody have a string? Oh my God, because it doesn't look straight right now. Thank you. So with that one, you kind of just want to take the line. So this one needs to go a little bit over. That's it. Thank you. Then for 15, you have to locate 2 landmark points first. So that one is a little bit of a tricky one. So the first point you need to find is the jacuzzi with SI 13. That's the first one. The second reference point, you need to find gallbladder 21. So we're going a little bit ahead. You find the outer edge of the acromion in here, and halfway, highest point on the shoulder is where gallbladder 21 is. And now Jiao 15 is right halfway between. And that's like a really good point to help like with tension in this area. If people have like upper back pain and a lot of tension, that's a really good point for that. So that's Jiao 15.
So Sanjiao 15 again is in between SI 13.
SI 13 and gallbladder 21, like right between those. Now, if you can turn sideways, looking to the window. Thank you. So now the channel travels up the neck, and for Sanjiao 16, you simply go from the ankle right here, you follow this straight back behind the sternocleidomastoid, and right there is where Sanjiao 16 is located. So right there. 17, which is the best local point for ear issues, is right underneath the earlobe in the depression. So right there is where Sanjiao 17 is. And with that one, like if you needle it angling a little bit upwards, you get a bigger effect on the ear. If you needle it angling a little bit downwards, it has an effect on the glands and the throat on the lower area as well. So with that point, how you needle it can make a difference. And then from 17 down there, you just go, you have directly around the ear, and you need to divide it again. So you have 17 is the lower border, and then at the tip of the ear, you just press the ear against the head and put the point where the highest point of the ear is. This is Sanjiao 20. And now what you do to find 18 and 19, you simply divide this distance in thirds. So you have, and again, you can just press the ear onto the head and then put the points where it belongs. So see when you lift it up, now you have 17, 18, 19, 20. So this probably needs to go a little bit down, and this a little bit down. So there you have it. And then the gallbladder channel will run right here. So that will be one sun further out. So you have 17, 18, 19, 20. Now with 21, remember you have gallbladder 2, small intestine 19. And can you open your mouth, please? Okay. And now can you close it again? Thank you. So right there is Sanjiao 21. So now it did the nice circle around the ear. Now for 22, you move up here. So there's like right where the ear ends here is a depression. And that's where 22 is. And then from 22, you go to the last point where you take the eyebrow, you follow it out. And right there is a depression at the end of the eyebrow where the Sanjiao channel ends. And then right there is where gallbladder starts. So here's the end of one, and this is where the other one is. I mean, if you want to, I can just put in yellow the few points we've done so far on there. So you see it in relation. So